Good evening, everybody. Welcome back to our weekly Stats with Sara report. My name is Sara, the epidemiologist here at the Jefferson County Health Department, and tonight we are reviewing the week 36 COVID-19 data. CDC's week 36 began on Sunday, August 30th through Saturday, September 5th. So the data that we will be talking about today includes everything up until that date. We release a few various reports each week, and I like to start off with the weekly COVID-19 surveillance report for the entire community. So this report includes the community-based cases as well as those long-term care facility cases. During week 36, we had a total of 402 confirmed and probable COVID-19 cases in Jefferson County. This brings our year-to-date total to 3,171 as of this past Saturday, September 5th. As of week 36, there have been 49 COVID-19 related deaths to report, as well as 18 outbreaks in our long-term care facilities. Outbreaks in those long-term care facilities are defined as one or more confirmed cases of COVID-19 in residents or staff. During week 36, 27 of our confirmed and probable cases were in long-term care facilities, meaning that 375 cases were in the general community. Let's begin, as always, by looking at Table 1, which shows the number of confirmed and probable cases by week. The week 36 data consists of everything reported to us beginning August 30th, which is the date that is listed on that second column, and tracks everything through the end of the week, which was this past Saturday, September 5th. There were 402 cases this week for a total of 3,171 cases overall. These numbers might look a little different than some of the graphics posted on Facebook and on our webpage because those graphics include the most recent numbers from the past few days, whereas this data only includes information up until this past Saturday. We like to analyze that data based on a full CDC week's worth of information. This table includes our lab-confirmed and probable cases. The lab-confirmed cases include those individuals who receive a positive result from a diagnostic test. And as a reminder, those probable cases include individuals who have met two very specific criteria. So one being that they were a direct contact of a positive case. They were within that 6-foot distance for 15 minutes or more of that positive case. And two, they have become symptomatic since having been in contact with that positive case. So the likelihood of that probable individual having COVID-19 is very high. They may just be waiting on a test result or have not even been tested yet. If you would like to know more about how many of those cases are lab confirmed versus how many are probable, refer to those graphics with the bubbles that are on our Facebook page and on our website, because it is listed there. I also go over the PCR positive and negative test data a little later together in this video as well. In Figure 1, we see the confirmed and probable cases by week. On the right-hand side there, you can see our weekly case count sitting there at 402. Unfortunately, we are still trending upward with those cases. We definitely need the help of everyone in our community to do their part in preventing the spread. It's so important to continue those mitigation strategies because we really don't want to see that number trend upward any more than it already has for many different reasons. We can practice some very easy habits to do our part in helping prevent that spread in our community, such as that physical distancing, so staying 6 feet away from others while in public, wearing our masks if we can't do that physical distancing, and being more diligent about our hand hygiene. The next chart shows a breakdown of the daily case numbers and the 7-day rolling average of cases. The dotted line is the number of daily new cases, which you can see it fluctuates from day to day. And that solid blue line is that 7-day average, which helps to smooth out those fluctuations in the data. The 7-day average of cases is one of the indicators that is used for that color guidance chart for our county. Right now, our 7-day rolling average has reached over 57 new cases per day. And as many of you know, this has bumped us up into that red status for our county. The 57 cases per day shouldn't be confused with that 25 number that you see that's on the color chart. So that 25 number is 25 new cases per 100,000 residents. It's one of those rates that we use and that I talk about sometimes. So it doesn't mean that we are seeing 25 new cases a day amongst our 225,000 residents. We are seeing approximately 57 new cases a day amongst our entire population, which it definitely adds up quickly as we move from day to day. So if you're curious about what the actual number of cases per day is for our entire county, this particular graph with the 7-day rolling average and the daily cases is going to be your best resource. Next, let's look at the overall age group data in Figure 4. The 20 to 29 year age group has 571 cases so far, which is the most of all of our age groups. The 80 plus age group still has the highest rate per 10,000. And once again, the 0 to 19 year age group data will be reviewed in further detail as we finish reviewing our regular weekly surveillance data. In Figure 5, we will be looking at the fatalities and the fatality rate by age group. There are now 49 reported deaths in our county, most of which have been in our 80 plus age group. Our cumulative fatality rate of 1.55% in Jefferson County is still lower than both Missouri and the US. Missouri's fatality rate is 1.76%, and the United States has a rate of 3.01%. Please remember, though, that this is a preventable virus, and if we all do our part to slow down the spread in our community, we can help prevent some of those hospitalizations and some of those deaths. Even if the number of deaths may not seem like a lot to you, they are still loved ones of those in our community, and that's definitely something that we need to remember. In Figure 7, we have the COVID-19 PCR test results by week, as well as a nice visual of that % positive rate. This data does only include those lab confirmed cases, so the number will look different from our main weekly case count because it does not include those probables. That dark blue dashed line is our % positive, and as you can see, it's continuing to rise. Let's break down these numbers a little bit more in Table 3, where we can actually see those values of the positive and the negative test numbers. In week 36, we had 373 lab confirmed positive cases. So that is 373 separate people who received a positive result from a diagnostic test. We never include duplicates in our count, and we have staff who diligently work to make sure that even if duplicate lab reports are sent to us, then none of them are ever counted twice in our overall count. This count does not include any of those probable cases either. Our % positive for week 36 is currently 13.6%, and we do have many negatives that have already been reported to us, and you can see that number down in the bottom, and that's that 2,365 number that's sitting there right now. I do anticipate that our % positive may change slightly as we receive more negatives. We have been getting around 2,800 the past couple of weeks. So as we receive more reports of those negative tests, that % positive will adjust just a little. 373 positive tests is the highest number of positive tests that we have seen so far, though. For those who aren't aware, we do rely on the state to process and report those negative test numbers to us, and there's often a 3 to 4 day delay when it comes to those. It's not uncommon to see that % positive change for the previous week or two until all lab reports come through to us. I always keep these numbers as updated as possible in order to be as accurate as possible when it comes to that % positive. Small fluctuations in the data should definitely be expected as more reports come in, and that % positive usually levels out after about 2 weeks. One more small reminder when it comes to those diagnostic tests, if you do go out and get tested for one reason or another, please remain home and limit your exposure to the public as much as possible. Just because you haven't received confirmation of that result of your test doesn't mean that you aren't still infectious. So it should be obvious, but if you are feeling bad, please stay home. And if you have gotten tested and haven't received a result back, please stay home until that testing center or until the health department gives you a call and gives you further directions. Moving on to Table 4, the COVID-19 cases are divided up by race and rate per 10,000 residents. The white population in the community now has the highest number of cases with 2,459, as well as the highest rate per 10,000. As a reminder, we do not include any missing or unknown race data when calculating these rates. For the zip code data this week, we can see the cumulative number of cases in each area shown in blue, as well as the active cases in each area shown in orange. The active cases are those new and recent cases that are currently under investigation and are in the process of completing their isolation period. So our Arnold area, 63010, still has the highest number of cumulative cases as well as active cases in the community. But a few other areas that have high number of active cases at the moment, which are those orange bars that you're looking at in this case, are 63028 Festus, 63050 Hillsborough, and 63052 Imperial. As we look at the cases by zip code per 10,000 residents, things look much more even across all areas in this graph. The rate per 10,000 takes the population of each individual zip code into account. So this helps to give a fair comparison among some of those areas that may have higher populations or those that have smaller populations. As you can tell, many of our areas do have a very similar rate per 10,000. Currently, the 63019 area, Crystal City, has the highest rate per 10,000, but Festus 63028 is right behind them there with a fairly high rate as well. For our hospitalization data this week, we are once again going to take a look at the data we received directly from those local hospital systems. We are still currently receiving information from BJC and Mercy and haven't quite yet received any of that data from SSM, but we are actively working on that. So what this means is that the hospital systems report that you'll find on our website, as well as the data that I'm about to present, is not necessarily complete data. There are hospitalizations at those SSM facilities that we are aware of through our resident reported data that are not included in this report because we haven't gotten that information directly from the facility. This also means that there are deaths in which we are aware of that occurred in the hospital but are not on this report as well. So what is presented to you in this hospital report is meant to give you a snapshot of what is occurring in our community. It's not definitive data at this point, but it is a good way for you all to get an understanding of how severe some of these COVID-19 cases can be. As of week 36, a total of 216 COVID-19 associated hospitalizations have been reported from the hospital systems for Jefferson County. 29 of these patients have been admitted into the ICU and 11 positive COVID-19 cases have required ventilators. In figure 2, we see those hospitalizations by age group. The hospitalizations that are counted are going to be everything from an emergency room visit to those who are actually admitted as an inpatient. Each one of our age groups has experienced at least one hospitalization, and the highest number is now in our 70 to 79-year-olds with 40 hospitalizations. And as you can see, there really is not any one particular group that has an overwhelming majority of those hospitalizations. As we move from week to week, we are seeing numerous admissions in each one of these age groups. Please follow along on our Facebook page to learn more about the hospitalizations throughout our county and the surrounding areas. We share a lot of information from the St. Louis Pandemic Task Force, which gives an overview of the hospitalization data from the St. Louis area, and Jefferson County residents are included in that report. Next, we will take a look at the length of hospital stay. We have had a cumulative total of 82 emergency room visits, which is a sign that those individuals have experienced symptoms that were severe enough for them to seek help. There are currently 21 Jefferson County residents who are still in the hospital at either BJC or Mercy facilities and are COVID positive. Most of our hospitalized residents remain in the hospital for about 1 to 2 days, but there is a good amount of residents who have been staying longer than that as well. Our last report, once again, will be reviewing that current school-age population data. As of week 36, there have been 389 total lab confirmed and probable cases in the 0 to 19-year age group for Jefferson County. In Figure 1, we see the number of confirmed and probable COVID-19 cases by week for the 0 to 19-year age group. During week 36, there were 70 cases reported for the 0 to 19-year-olds, which is the most we have seen for this age group so far. That weekly number of cases for our youth has been continuing to climb. In Figure 2, we split these cases up by zip code. So just like our main weekly report for zip code cases, we have the cumulative number of cases in blue for each area and the number of active cases in orange for each area. Once again, we have 3 areas that have over 10 active cases right now: 63010 Arnold, 63028 Festus, and 63052 Imperial. In each report, I show a graph, the daily number of cases, as well as the 7-day rolling average for each age-based grade level. And for our slide here today, I'd like to show the chart for our high school age group, which is the 14 to 19-year-olds. Our other grade levels had a pretty steady amount of cases from week to week. However, the cases in our high school age group just continues to rise. You can see this by that solid yellow line, which is that 7-day average. So if we are looking at that dotted yellow line, you'll notice that the daily case counts for this group tends to really fluctuate. But overall, that solid yellow line has continued to trend upward since around the beginning of July. And that's all we have today for today's stats. Thank you so much for continuing to spend time listening, watching, and learning with us. Please leave any questions that you may have in the comments or reach out to us via direct message. We appreciate those of you who have shown your support and continue to work hard to stop the spread of COVID-19 in our community. So please continue to stay safe and healthy, and have a great night, everyone.